Anal fissures. Sounds like it hurts. It does. We have a colorectal surgeon here on Talking with Docs to help us understand what's going on with anal fissures. I'm Dr. Paul Zalzo.
I'm Dr. Brad Wiening. We have Dr. Ian Choi, colorectal surgeon, with us today. Thanks for joining us, Ian.
Thanks for having me.
We're going to talk about anal fissures right from A to Z, what it is, non-operative treatment, surgical treatment. So let's start at the beginning. What is an anal fissure? It just sounds like it hurts.
A fissure is a tear in the lining of the anal canal.
Okay.
Usually happens if you're having a particularly hard bowel movement, lots of straining. Sometimes people, though, can get it with like lots of diarrhea too and frequent bowel movements.
Okay. So a tear in the lining of your anus or your anal canal.
So what am I going to be experiencing if I have an anal fissure? In other words, what is the history? What am I presenting to my doctor saying, this is what's going on?
Well, you're typically going to present with pain, like severe pain. Patients describe it like a hot knife cutting the area. Bleeding is also a frequent symptom with that pain.
And is the pain with bowel movement or just walking down the street?
Usually just with bowel movements. Sometimes people can have a little bit of bleeding in between, but typically it's just with bowel movements.
And it's kind of a vicious cycle because you're having this pain, so you're afraid to go to the washroom, so you don't go to the washroom, so you get a little bit constipated, which makes things worse.
Well, what happens is when you get the pain, your body's natural reaction is to tighten the muscle in the area and get these muscle spasms. And when you get that muscle spasm, it decreases the blood flow to the area. And when you get decreased blood flow, it prevents that tear, that fissure from healing. And then, so you get a bigger tear, more pain, more spasming, and it's this sort of positive feedback loop on itself.
Sheesh.
Okay, so that's what your history, and then so you're going to go see your doctor about this. What kind of things is the doctor going to look for on physical exam?
They can be hard to see. When they're really big, you can see it just externally. Sometimes, though, you have to get right in there with a little proctoscope to see a smaller one that's a little bit higher up in the anal canal. So, sometimes on just cursory view, your doctor may say, I don't see anything.
Right.
But if you go see, a surgeon who takes a bit of a closer look, they can diagnose the problem.
All right, so that's the history, that's physical examination. You've been diagnosed with an anal fissure. What are my treatment options?
Well, again, first thing that we need to deal with is the root cause issue. So fiber, fluids are always the first thing I always put patients on.
Preaching to the converted. We talk a lot about fiber for constipation. We've talked about it in our hemorrhoid videos, even with you. So got to get more fiber in our diet. North Americans are notoriously bad at doing this. So you said before, you get them to see a nutritionist actually.
Yep. We have a nutritionist that works in our office specifically to talk to patients about this. Getting fiber with either through diet or supplements, as well as getting more fluid in your diet is always the first place we start. In terms of treating the fissure itself, it's all about breaking that feedback loop. So what we're trying to do is find ways to relax that muscle in the area to allow more blood flow to the area to allow that fissure to heal.
So it will heal itself. It doesn't need like a stitch or anything like that right away?
We're not trying to close it off. You're just trying to let the body heal itself, right? Okay. So usually the first thing we do is prescribe some sort of cream that relaxes that muscle. So nifedipine cream, diltiazem cream, those are the most common
calcium
things.
Channel blockers.
Exactly.
Often some people might know these names because they're taking them for their blood pressure.
Yep.
Okay,
it does the same thing.
So something topical. Yep. Okay. But not a formal muscle relax. You don't use like things like Flexeril or like that kind of stuff? Not that you'd like a 8535 for your bum.
No, these are kind of,
more focused.
There's no deep breathing or meditative techniques for your bum either.
Probably not.
Probably
who
not.
knows? Maybe.
You can try it.
Yeah.
Okay, so you try the topical, and then you're trying to break this pain cycle in addition to softening up your stool. Ultimately, and paradoxically, we want a large, soft stool.
Yes.
Right? So some people think, oh, it's too big. If I take fiber, I'm going to have this really big stool. You want to not strain. You want to have it soft and just have it flowing out of there easily so that it doesn't tear.
The analogy I give to patients is it's like a tube of toothpaste.
Okay.
Right? You can have a full, brand new tube of toothpaste, and it's really easy to squeeze out. But when the tube is empty, you got to work really hard to squeeze it out. Right? The consistency of the toothpaste is the same.
Right.
Right? It's soft. Right, but the difference is the bulk, right? So that's why the stool softeners, laxatives are not that great for this kind of issue. Because you need the fiber to bulk up the stool so that your body's able to expel it easily.
Do not brush your teeth with this stuff. Okay, so we've established that the thing is going to heal itself. The fissure will heal itself if we let it by doing these things, the fiber, the liquids, and relaxing the muscles out there.
Yeah. Now, sometimes it doesn't work.
Okay, what kind of time frame are we talking on? So I show up, I'm like, listen, I've been suffering with for 2 months now.
Yeah.
How long are you gonna give me of this, of the cream and the fiber therapy before you're like, okay, we maybe need to go to step 2 or?
I typically follow patients up at about 4 to 6 weeks.
Okay.
Usually by that point, you get a good sense of is it heading in the right direction or not.
Okay.
Either patients are noticing an improvement or complete resolution, and we say, great, we'll keep on going with the creams. But if they're not, then we have to start looking at more invasive options.
Okay.
All right, let's go
Go to it.
What's the bottom line on these?
So again, same idea. What we're trying to do is find surgical options to relax the muscle. Back in the day, what we used to do is something called a sphincterotomy.
Okay.
So this is a surgical procedure where we actually divide part of the sphincter muscle. That's a permanent thing. Once you divide it, it's gone.
Okay.
So you do lose some function of the sphincter muscle permanently.
Which is going to make a lot of people nervous. Makes me nervous. Yeah, it makes me think, oh, geez, is this the best idea?
That's why it was back in the day.
Yeah, back in the day.
So do we do this at all anymore? Is this a last resort?
This is a last resort.
Okay.
Now, what's more common is Botox injections.
Okay.
Right, same Botox we use for our faces. We can use in the anus as well.
Your anus looks 20 years younger. What'd you do?
That's what we do. We give people a 20-year-old anus again. It relaxes the muscle and again allows that fissure to heal by increasing the blood flow to the area. The nice thing about the Botox is it wears off after about 3 months.
Okay.
So usually that's enough time to allow that fissure to heal, again, as long as patients are keeping up with the fiber and the water and whatnot.
Is that something you could redo again?
Yep.
Yeah, if need be, if I say at 3 months, you're like, it's better, but it's not all the way there, you could do more Botox.
Exactly. And I try to see patients in that 2-month frame after the Botox injection so that if we get a sense that it's not fully healed yet, we can book them in for another injection before that first injection wears off.
And this is just done in the office, like with any like local anesthetic or anything, or how does it work?
No,
the procedure itself works?
This is done in the OR.
So you know
need
exactly.
some sedation.
Got it.
You need to put a scope in the area to get a good
right.
visualization.
That's
good to know.
Yeah, get the right spot. And I would imagine it's quite painful if you didn't do it with an anesthetic. So this is a full-on anesthetic to get this done.
Yes, yeah.
So it's a procedure. Okay, so you've got that is done way before you consider dividing the muscle.
Yeah.
So Botox, anything else?
That's basically it. Yeah.
All right. And how long have we been doing Botox for this for? Is that relatively new?
Oh no, we've been
Botoxing for a
years.
while?
Years. Yeah.
Interesting.
There
And
you
that's, we've talked about this in medicine before, where different medicines have different uses, and because I know they use it for cerebral palsy to reduce like muscle tension, and there are a lot of uses other than reducing our apparent age. Yeah, that's amazing. Yeah.
All right, so that's the anal fissure. And what percentage of the time would you say it's going to heal itself if we do the right thing with the fiber and the liquids and maybe even the creams?
Yeah, with the conservative management, so fiber, water, creams, usually about 75% of my patients will get better with that alone.
That's great news, right? Your body will heal itself if you let it. And however, we do have some good treatment options available if it doesn't heal itself.
Let's talk about the last one though. So we said we did it back in the day when you did the sphincterotomy. What is it? What are the complications of it? Like why don't we just say, well, listen, this is definitive. It's definitely going to heal the fissure.
Yeah.
What are the risks or the complications?
Well, you know, the main thing we are worried about is if you cut too much muscle,
Right.
then you're going to have some issues with either incontinence or urgency, not being able to get to the bathroom in time, these types of issues. So, you know, you always have to be very careful about how much muscle you divide, and in spite of that, you can still get these types of complications.
Got it. And I tell you, this really just brings home the whole thought of just eating properly for your general health, not just for your anal health or for your heart or for your GI tract, but just eat more fruits and vegetables and have that fiber and water in your diet because it provides so many benefits.
We've said it before,
A million times.
right?
Okay, if you like this video, please like it, subscribe to our channel, leave a comment about your experience with anal fissures and any potential treatment that you've had.
Dr. Choi, thank you so much for sharing all that with us. I learned even in this video. Every time you're on the show, I do learn a lot. And remember, you are in charge of your own health.
We'll see you next time.